I just want to say I feel very honoured and privileged to be here, and I'm very excited to learn today and to also take a lot of the learnings back to all of the incredible women that I work with at Our Watch. So today, very briefly, Natalie and I are going to give you a little bit of a flavour of two resources that were released over the last few weeks. So Men in Focus and also the Healthier Masculinities Framework. But firstly, just thinking about this focus on masculinities and this turn to looking at masculinities, in my role, it's looking at it in relation to prevention of violence against women. That historically, as has already been said this morning, that masculinity is seen as the default. So often when we're thinking about the human subject, we're assuming a male subject. And we know the problems of this, particularly in research, in health, delivery practice, etc. But what has come out of this also is that often we don't gender men. So we haven't thought of masculinity as a lens to think about men and to think about other health issues for women and also broader social issues. So this this is particularly in the prevention of violence against women sector, there is this emerging focus on men and masculinities and to really use that as a lens. So it's quite, in the academic context, I think it has been quite well established, but definitely in the sector, in the prevention sector, it's a real emerging focus, and there's a lot of work that has sort of exploded in the last year or two on this. We know there are some very significant pieces of research that have emerged in the last year. The Man-Box study, which originally in 2017 was conducted in the UK, Mexico and the US, that it showed there were some very strong links between dominant forms of masculinity and violence against women. And of course, in all of this, when we're thinking about violence against women, we're thinking about all of the health impacts that come from that, as has been mentioned. So the ramifications for mental health, trauma, substance use as coping mechanisms, and so forth. Also, very significant that the American Psychological Association looked over 40 years of studies, of psychological studies, and thought, we don't have guidelines for men and to look at masculinity. And here they really pointed to those links between dominant forms of masculinity to mental and physical health of men, but also of women, and all the social problems that come from that adherence to particular forms of masculinity. So the resource Men in Focus that I produced over the last year at Our Watch was really looking at these links and across all the different levels of society. So gender inequality is a driver of violence against women, but also delving a little bit deeper and building on that existing knowledge to think about, well, how do gender roles, stereotypes of masculinity, male-peer relationships, how do men act in certain contexts and settings, how does all of that help to drive violence against women? So it really started from using a lot of the sociological, psychological research to define what masculinity was. This is really from the outset setting it up. So we're thinking of it firstly as a social construction, as a set of social expectations or standards for how men should think and act. So not that men are born with these characteristics, but from a very early age being socialised and encouraged to take these up. That it's multiple and situational, that we're not talking about one model that men adhere to. There are many different ways that men behave, but there is a dominant set of characteristics that we expect men to engage in. And that it's situational. So one single man isn't necessarily or doesn't behave the same in every context. There are some contexts where he'll behave, he'll emphasise these behaviours, and then in other contexts, perhaps with his friends down at the pub, that we see different kinds of behaviours. Crucially, that it intersects with the other aspects of identity and social location to produce a different experience of being a man, but this has effects as well. So race, class, sexuality, religion, ability, age, we can keep going, the Australian context of colonisation, all of this is really important to think about. And this paper took an intersectional approach as a lens to think about the ways in which men might be impacted, but also about privilege as well. So to think about how men are privileged and how this all creates different pathways towards violence against women, how it affects those patterns of violence against women. And crucially, again, that it's embedded across the levels of society, so social norms, structures and practices. So just a few little highlights before I pass on to Natalie, but some of the key findings that there are particular norms and attitudes that we expect men to adhere to, and these wouldn't be surprising, I think, to anyone in the room. I could ask you this question, you'd probably come up with exactly these here. Dominance, aggression and being in control. There's been a lot of research on how this does link to violence against women. Autonomy, so being independent, stoic, hypersexual, taking risks, compulsory heterosexuality, that all of these are the pressures that men, that they're expected to adhere to these attitudes and behaviours, and crucially that this has effects on women and others. The Man Box study found that men who form a rigid attachment to these norms and stereotypes are more likely to display sexist attitudes and behaviours, and therefore it's more likely to lead to violence against women. And this comes up a lot, I think, when I'm speaking, particularly to men. They say, well, is masculinity bad completely? Is it toxic to the core? And a lot of we can see links between a lot of those norms, but some of them, anyone needs sometimes in particular contexts. So sometimes you do need to be stoic, or you do need to take control of a situation, or that it can be quite contextual as well. But what the research found, that it was a rigid attachment. So it's when we think that men are only those things and not everyone else, that they are masculine traits, but also when we expect men to only be those things and not all the other range of human behaviour. So that is really where the problem lies. We're talking about health today, and another finding, it's really a side point, I think, of the resource, but that men do experience impacts to their own health due to dominant forms of masculinity and the pressures to conform to them. So we know that the leading cause of death in Australia for men between 15 and 45 is suicide. They're more likely to engage in risky behaviours or risky drinking. I know VicHealth has done some work on that. That a lot of the substance use for men might be to do with masculinity. It may be a coping mechanism, or they may not feel they can access support or express themselves in other ways. More likely to be involved in incidents of bullying and violence as well. And this, is really shown across the Man Box studies, not just in Australia, but in the US, UK, Mexico, particularly when we think here of the having thoughts of suicide. You can see that men who adhere to forms of dominant forms of masculinity were more likely to have these thoughts compared to men that sat outside of that. Crucially, that men who are impacted by other systems of discrimination and disadvantage suffer disproportionate negative impacts to their health. We know the stats here around lower life expectancy for Aboriginal and Torres Strait Islander men, higher rates of suicide, poorer mental health, less access to health services, and experience higher rates of violence from other men, so particularly men of colour, and also thinking about gay, bisexual, trans men, that there are higher rates of violence that they experience from other men. So men's violence harms everyone, and this research shows that there are links between dominant forms of masculinity and the violence that men do to women, to other men, to gender diverse people as well. A big part of this resource was to think about how do we engage men and boys in the prevention of violence against women. And Nancy and Lorraine have already mentioned gender transformative practice being absolutely crucial. And here again, that we encourage men to reflect on and challenge dominant forms of masculinity. Of course, this has to happen at all the levels, so at the individual level, but at the community level, the organisational level, the largest societal level, that we're thinking about, how to do this. And this is very challenging in this space. It's very easy for campaigns and initiatives and programs to use masculinity to engage men, to actually end up reinforcing masculine norms. And so that's something really to think about. How do we transform masculinity? And Natalie would talk a little bit about, what kinds of things are we promoting? What are the alternatives? That these questions are really crucial if we're thinking about gender transformative practice with men. Again, in this work, there is a tendency to, to say that men are impacted, their health and well-being are impacted, and that is absolutely true, and the research shows this. But it's important to use this carefully in the prevention sector, that it can't just become all about men. It's absolutely important that we're maintaining accountability to women, listening to women, engaging women's organisations, centring women's voices when we are looking at masculinities and the links to violence against women. So that's just a few highlights really from this research, and but I'll pass over to Natalie to talk about the framework they released over the last week.
Thanks, Shane. So for those that don't know about VicHealth, VicHealth is the Victorian Health Promotion Foundation, and we strive to keep all Victorians happy, healthy and well. And for close to 2 decades now, we have been working in gender equality, primarily focused on delivering projects, programs, initiatives, research and policy that seeks to empower women and girls, prevent violence against women and improve their health and well-being. But several years ago, we really started thinking about the other side of the gender equality coin, which is about working with men and boys in gender equality, and really thinking about how we can leverage off our partnerships at VicHealth through the sports sector, through workplaces, through a range of different settings and sectors that we engage with on a daily basis to do work around health promotion and specifically working with men and boys, but how we do this through a gender transformative way. And I guess it's something that we at VicHealth are conscious about, that we've always got a lot to learn about how we do this work well. So we're really conscious of embarking on this practice. And so while the empowerment of women and girls is always and will be a critical issue, there's growing evidence that indicated that initiatives that work with men and boys have dual impacts. Firstly, in relation to improving girls' and women's health and well-being due to improved gender equality, but as Shane was saying, also improvements in relation to men's own health and well-being, their work lives and interpersonal relations. And so we know that the National Community Attitudes Survey continues to find that compared to young women, young men show a lower level of support for gender equality and have a higher level of attitudinal support for violence against women. And other studies, such as the Man Box, which Shane touched on, have identified similar harmful constructions of gender roles and relationships, such as men should not express their emotions in public, should not show weakness or seek help. So over the past 18 months, we've been undertaking a range of formative practice around the topic of healthier masculinities, even in relation to how we talk about healthier masculinities. And we've had a whole kind of conversation around the terminology of healthier masculinities, and that continues. And I'll talk a little bit more about how we're seeking to, I guess, ensure that that in itself is an appropriate way to engage with men and boys on the topic by using this type of language. But really what we've done up to date now is produce 2 documents which are online, and you can see them on screen. One is an evidence review that was undertaken by Monash University to look at the topic of healthier masculinities and looked across the health promotion literature to better understand where gender transformative work has been undertaken with men and boys for a number of health and wellbeing outcomes. And then from that evidence review, we then produced the Healthier Masculinities Framework for Gender Equality, which was also informed not only by the evidence, but by a range of workshops with experts who work within this space to ensure that it was informed by practice as well. Because I guess a big thing that came out from the workshops was that it needed to be an accessible resource, particularly to some of those settings such as sports clubs that we do a lot of work with on a daily basis. So this is just an example from within the framework, and there's copies out the front if you'd like to take one yourself. But essentially the framework is a planning tool to support people and organisations promoting health and wellbeing, particularly when working with men and boys. It's a relatively new area of health promotion work, we feel, for a lot of settings within Victoria, and there's a lot of evidence still developing, but there is growing recognition that healthier masculinities is a key contributor to advancing gender equality and health and improving health and wellbeing for all Victorians. So this example here on screen is the ways in which attitudes, relations, norms, structures, behaviours and practices can be experienced across a number of the strategic imperatives that we at VicHealth have as our priorities. So mental wellbeing, physical activity, preventing harm from alcohol, promoting healthy eating and preventing violence against women. So the table's been taken from the framework and demonstrates how norms and stereotypes can be addressed across a number of these particular health issues. So I won't read all of these examples, you can read them in your own time, but if we just have a look at the preventing harm from alcohol focus as one example, you can see here we've looked at attitudes, which may be that men or boys view binge drinking or drinking to excess as risky and unhealthy. In terms of interpersonal relations, men and boys may stop friends from driving if they'd been drinking. In relation to norms, alcohol is not considered as an essential element of catching up with mates. In relation to structures, new advertising standards are introduced requiring advertisers to step away from portrayals of traditional gender roles and stereotypes when promoting alcohol products. And in relation to behaviours and practices, we've got an example that men, probably not boys, we don't want to say boys are using alcohol, but men rarely or never drink to the point of getting drunk. And so these are just some ways in which we can depict what some forms of healthier masculinity might look like, and encourage some of our agencies that we work with to think about how they could consider some of these ideas within the work that they do around health promotion across a number of those health and wellbeing impacts. So in our work in developing the framework, as I mentioned, we had a number of expert workshops. And so from the workshops and a review of the evidence, we arrived at a number of good practice principles to inform this work. So I'll just quickly run through those now. So aiming for change, and this is really about the importance of gender transformative practice being at the heart of working with men and boys in health promotion. Prioritising shared outcomes. So I guess this comes from the fact that many health promotion workers have said to me over the years, how can we work with men and boys in ways that improve gender equality for women and girls, but also result in shifts in other health and wellbeing areas such as mental wellbeing, alcohol consumption, etc. How can we join this work up to ensure we're achieving outcomes for everyone? Thirdly, acknowledging inequality, and Shane touched on this in relation to the importance of intersectional practice. Acknowledging that language is powerful, so how we talk about and how we frame this work. And I mentioned briefly that we're doing a lot of this at VicHealth at the moment. We're working with an organisation called Common Cause Australia, who have worked with us previously on looking at values-based messaging around health promotion, healthy eating and alcohol, and really helped us to think about how we frame our messaging to bring on board more of what we call the persuadables, so those people that sort of sit in the middle of the spectrum that aren't yet advocates but aren't opponents to the work. And so we're doing this at the moment. We're exploring what types of messaging will work for us to talk to young men and boys about healthy masculinity. How can we bring the persuadables over to our side? And so we'll let you know about the results of that work in the future. Next year we'll publish some resources around that. So I just want to move on to outcomes now. I know we're a bit strapped for time. Sorry, I'm getting that look. So I won't go through this again in any detail because this is in the framework, but we're really conscious about when we talk about this work, what are the outcomes we're thinking about? We're coming from, always thinking about what's the end result, what does success look like, what does promising practice look like? And this is a new journey for us. So this is where we want to start building the evidence around what are some of these outcomes at different levels of the ecological model. And as a result of some of this thinking and this kind of planning about how we try to build the evidence around healthy and masculinities practice here in Victoria, we are happy that we've now been able to secure funding internally within the organisation so that it is a priority to be able to support this practice across Victoria. And everyone loves the announcement of a good grant, so I'm just going to take 2 minutes to do this. So the VicHealth Healthy and Masculinities Partnership grants are now open, and people can apply for up to $140,000 over a 2-year period to undertake projects and initiatives that are really about engaging men and boys in gender equality, particularly efforts to transform harmful gender stereotypes, negative social norms, attitudes and behaviours. So the lead agency is required to be a local government, but they can work in partnership with a range of relevant organisations, and will fund up to 4 projects with funding commencing in June 2020. But there's the links there if you want to find out more information on how to apply for those projects. And really it's about using the guidance in the framework and the scoping review to develop your intervention. So thank you.
Thank you.